Hello and welcome, my name is Chris from christopherhole.com. Many thanks for watching this video where we're going to be looking at shin splints. Now we're going to look at some sort of different parts of the video. So we'll look at what it is, we'll look at some anatomy involved, we'll look at some causes, and we'll look at some potential treatments as well. But just remember, this video is education, not diagnosis or self-diagnosis. It's very much just to build your understanding. So go and find a other health or medical professional to help diagnose and treat this condition. Now, I'm not a big fan of the name shin splints because, as it says in the first sentence, it's a generic term for pain in the shin area, which opens itself up to many different interpretations. So it could be a stress fracture, it could be compartment syndrome, it could be medial tibial stress syndrome, or it could be periostitis of the medial tibia. Now, all of those different conditions are a condition in their own right and will probably require a video of themselves to better understand. But we're just going to stick with the shin splints for the moment, because there's a few things that we can do in order to overcome them without going too far down the line in sort of surgeries, so on and so forth. So first of all, we'll look at some of the anatomy that's involved. So if we're looking at stress fractures, that will generally be bones. So you've got the tibia here, which goes down, that's the big shin bone, and then you've got the fibula, which you can't really see, but it would go sort of down the outside of the leg and then join in at the bottom of the ankle, sorry, the top of the ankle, bottom of the lower leg, if you will. Then we've got compartment syndrome. Now, if I was to do a sort of a bird's eye view of your lower leg, you have sort of certain muscles grouped in certain areas, and certain muscles grouped together they call a compartment. And it's that compartment that becomes, or the bag that holds all those muscles together becomes too small for the muscles that are inside it. And then what you get is essentially a bit like a herniation that sort of pops out the bag. So it's a bit like a golf ball sticking out the front of your leg. Then you get the more sort of, I guess, well-known or popularized interpretation of shin splints, which is medial tibial stress syndrome. So basically, that's the inside of the tibia, so the inside of this bone here, so the medial part of the bone gets stressed essentially, and there's little micro traumas on it, and then that creates a pain. And then you get a periostitis of the medial tibia. And then you've got all of these muscles that could be involved in that. So on the back, you've got the gastrocnemius, both inside and outside, lateral medial head, plantaris, soleus, and then you come onto the Achilles tendon. Then you get muscles on the front, which are your anterior tibialis, your fibularis longus, extensor digitorum longus, and flexor digitorum longus as well. So you've got all of these different muscles that could be involved. So it's very much making sure, from your perspective, you've got a better idea of the type of shin splints that it is, if you will. So is it a stress fracture? Is it compartment syndrome? Is it medial tibial stress syndrome? Is it periostitis of the medial tibia? So it's very much just understanding which one it is before you then go about like treating it per se. That may take a little bit of trial and error, which is absolutely fine, but that just means you as the individual just needs to be a little bit patient in your recovery period, because it could take longer than you think if you don't get it right the first time, if that makes sense, or if another health professional doesn't get it right first time. And that's absolutely fine. That's a completely normal part of rehabilitation. You may explore one channel, but you find that it doesn't work out and you have to explore another channel. So then we come on to potential causes of that. Now again, they are quite lengthy, but there are sort of general common threads to it. So you've got an overpronation, which is the foot falling in flat, sudden increase in training, so your running miles go from 40 to 20 in a week, go from 20 to 40 in a week, running in spikes and forefoot strikers and hard surfaces. So when you're running up on your toes, if the muscles of your feet and the muscles of your ankle aren't functioning properly, you can get a lot of stress going right up through the foot. Sports with repeated landing and taking off, anything that involves a lot of jumping, insufficient warming up, so you're going into something too soon, or you've got a tight soleus muscle, which is the muscle down at the bottom of the leg here. So again, there are a lot of potential causes. So as a part of your treatment, it's trying to sort of use that trial and error, bit of a process of elimination. Think about what's the cause, because that will be a first part of your treatment, is first of all remove the cause, then start going about putting in place a rehabilitation program with another professional to help get you back to your fitness levels, if you will, which might involve improving biomechanics, which is to do with exercise and exercise technique. Then it might be massage, so getting good blood flow back to the area, getting good blood flow into tendons and ligaments and periosteums and things like that. But also taking a bit more care with your warm up, with your workouts. Not going in 100% from minute one, but gradually building into your workout. So hopefully that's been helpful. Just as a quick summary, there's a lot of things that it could mean because it's a generic term for pain in the shin area. So take your time to work out what it is. Take your time to figure out what tissues it's involved. So it could be Achilles tendon, it could be muscles of the front of the leg, it could be muscles of the back of the leg, and then start thinking about what is potentially causing it, which will then allow you to move on to sort of a better treatment process at the end of it. So many thanks for watching. My name is Chris from christopherhall.com. I'll speak to you in another video.